Welcome to Master's Health Center's podcast, where we discuss all things Chinese medicine and Chinese martial arts. Our goal is to help you achieve better health and wellness. We hope you enjoy today's episode. Hey, well, welcome to Master's Health Center's podcast.
Yes.
That was great. So today, I'm Master Tai Hao Lu, and then we have Andy Alzamora with us today. He's also a licensed acupuncturist. And so we're going to be talking about some topics within Chinese medicine, I think. And, we have the interesting thing with Chinese medicine, which I think a lot of the public don't know, is that there's more than just acupuncture.
Right. There's different branches to Chinese medicine.
Yeah.
Besides acupuncture.
Yeah.
One of them being like Tai Chi, right? Or physical exercise.
Yeah, physical exercise. And so we'll just discuss some of the branches of Chinese medicine. We have acupuncture, you have the Chinese herbs, you have the tuina, which is like the Chinese medical massage, the food therapy,
and
then nutrition, the exercise.
And physical movement. Exercise.
Yeah, physical movement. And so, but I want to ask you, Andy, you want to talk to us more about acupuncture?
So acupuncture, diagnosis-wise, this is something we were talking about earlier, right?
Yeah.
Like how do we diagnose? And we were talking about pulses, among other things. So different acupuncturists, like I think you agree, right? From different regions, they practice acupuncture differently, or they'll diagnose differently.
Yeah.
But some of the more common things is we'll check pulse and we'll look at tongue.
Yeah.
Personally, for my part of diagnosis, when I diagnose someone, I check pulse, tongue. The questions, I believe, are very important. Like when someone comes in and you're asking them those 10 questions that we usually ask them, that seems to really narrow down certain patterns that they're having in order to treat them. And another thing that I use as part of my diagnosis is I check the hara. That's what they call it in Japanese acupuncture, which is mostly like your belly and your center. And I'll just feel around your belly button, maybe in your lower abdomen, upper abdomen. The reason why is because that being the center of your body, any pain associated with that is probably related to whatever chief complaint that you have, whether it's sciatica or shoulder pain. So I implement that into my diagnosis, along with pulse and tongue. And then off of that, and whatever points help relieve whatever pain there is in the body, that's how I usually choose what points I use for treatment.
Oh, that's great.
Yeah.
That's awesome. So with the different styles of acupuncture, I know you're more focused on like the Japanese style or Kiko Matsumoto's style.
Yeah.
And what, in your experience and your thoughts, what is the difference between like the Japanese and the Chinese?
I think there's a lot of what's that word? Crossover, more than differences. The Najing.
Like there's a lot of similarities,
right? From what I understand, there's not a lot of like differences, but the Nanqing, right? I believe they originally talked about using palpation as part of your diagnosis. So there was a certain period in I believe in the acupuncture history where acupuncture traveled from China to Japan, and from what I understand, the Japanese, they kept that original approach, the palpation, right, as part of their diagnosis, and they went with it. They went with it for many years, and there was a famous blind acupuncturist in Japan. I don't want to say his name just in case I get it wrong, but next time I'm here, I'm gonna like say it out loud. But he was a blind acupuncturist. So he got very good at palpation and feeling pulses and figuring out what points work for pain in certain areas of the body. So in that regard, if there is a difference in Chinese and Japanese acupuncture, I would say they just emphasize more on pain around the belly and using certain points that help get rid of that pain, along with treatment approaches. they don't emphasize much in especially Kiko style. They don't emphasize a lot on pulse.
Okay.
Not to say they won't do it,
Yeah,
but
but
it's not,
not
exactly.
as
It's more
emphasis.
emphasized around the belly.
That horror and stuff. That's where the diagnosis would come from,
Yeah.
and even treatment and stuff,
Right.
which is very interesting because just as you were talking about the horror
Mm.
in in Chinese there's a subset of acupuncture is the abdominal acupuncture,
Turtle
the
acupuncture. Is it
turtle,
called?
yeah,
Right?
and so you have like the body and
Mhm.
stuff on the stomach as well, on the abdomen. So
Interesting
it's very
history too.
interesting,
Yeah.
when you think about it, how everything kind of correlates. You mentioned palpation, and so in the classics like the Nanjing, um, it does talk about palpating the channels. And there's a Chinese doctor. He's passed away, and there's several of his apprentices as well. But he focused on palpating the channels, and so part of the diagnosing and learning was feeling the pulses, and then at the same time palpating the channels. And as you palpate, you can feel the different nodules
Yeah.
and the
Yeah.
tenseness
The nodules along the channel.
yeah, along the channel, so you can get an accurate diagnosis what channel's being affected. And then and for everyone that don't know, when we talk about channels, we're talking about, like, most people will call them meridians, and but the channels, they transport the blood throughout the body that will nourish the body and the organs. We also say the qi, so essential substances to the body, and they're like spaces within the connective tissue and the muscles, but they're also wrapped around the connective tissue and the nerves and everything. They correlate that through that. And along the channels are the acupuncture points.
Yeah.
And so each channel corresponds to an organ system, like the lung channel, heart channel, spleen channel, like that. But, you're talking about palpation. You can palpate along those channels to get even more of an accurate diagnosis, to see what channels affected, and to treat or balance out those channels, to see what points you want to use, what channel you're going to treat to help. So, for example, give an example of what channels would you treat, or how would you go about treating like low back pain?
I have a question for you too.
Oh,
But
okay.
all right, but for low back pain, um, that's an interesting topic because it's never it's there's certain patterns with low back pain that you can use, and there's effective treatment points that will always work. Then every once in a while, you get someone with low back pain that has a different pattern, and you treat it differently. Um, for instance, we were talking about earlier, like on the way here, we were talking
Hmm.
about post diagnosis, right?
Yeah,
And when feeling someone's pulse, I ask you, have you felt more than 10,000 pulses yet?
yeah.
Because, according to
Uh-huh.
Chinese medicine, you need to feel about
A
10,000
lot of
pulses
pulses.
to understand it, right?
Mm.
So, with someone with low back pain, for instance, if I'm feeling the pulse and I feel it like their pulse rate is rapid,
Mhm.
and it doesn't have to be necessarily fast because, according to Chinese medicine, we also count the beats between respirations, right?
Mhm.
Right. So like as my belly comes out and goes back in, like that's the whole respiration, breathing in and out,
Mhm.
counting the pulses in between that one respiration would also tell you if there's a rapid heart rate. Doesn't have to be 100 beats per minute, right, to be tachycardia. But anyway, so when someone has low back pain and they have a high heart rate, and I can tell from the pulse, I won't treat their back because putting a needle around that area complaint, if someone has a fast heart rate, they're usually gonna have a reaction like
Yeah.
like
Yeah.
their heart, their shen is already like at a level where it's kind of like already maybe agitated is the word I'm looking for, but maybe hypersensitive as well.
Yeah.
So putting a needle on the back with someone with a high pulse rate, maybe not the most effective approach. You can try it.
Yeah.
What I do is I put it in the belly, in the front,
Mm.
because the front reflects the back.
Yeah. Yeah.
So check the area. I check the area where they have complaint. Is this where it hurts,
Yeah.
right? And then I'll palpate along the abdomen, and I'll hold it a certain point with my finger, and I'll check back around the low back. How does it feel now? Oh, it feels better. Maybe not 100% better, but it feels a lot better than when they came inside.
Uh-huh.
And that's the
Yeah.
point I use right there.
Oh, that's great.
And that's how I treat
That's,
low back pain.
that's good.
Right,
That's
yeah.
good.
Mhm.
That's very neat.
hmm
Yeah, I think there's just a lot of different uses, a lot of different ways we can treat,
So many ways.
but also treating a lot of different health conditions. Of course, low back pain, migraine headaches, neuropathy. You know, lately we have people that have addictions, or people that have maybe stroke rehab. It's amazing all the different, tendonitis, bursitis,
Sciatica,
all of those type of things.
neck pain,
Recently, I've been treating a lot of people with cancer,
cancer,
helping with like cancer support, whatever their,
constipation,
other,
pains.
if they're going through chemo or any other treatments for cancer, how we can help them and help their body.
Right.
So it's pretty amazing. One of the things I think, especially in the U.S., is that most people, they're more interested in acupuncture, and they always want to know how does it work.
Yeah, it's an interesting question.
What's your take?
More than one way. It works in more than one way.
Yeah.
Like I'm studying it. It's been years now, and I'm still studying every day because, like again, well, you had the physiological way, right? If I put a needle somewhere, right, there's gonna be a physiological effect on your body, right?
Yeah.
White blood cells, red blood cells, more oxygen, more nutrients,
Yeah.
platelets, red blood cells. They pick up the waste from that area.
Yeah.
There's a certain effect that happens in your brain too. Certain areas light up with
Yeah,
that,
yeah,
right?
yeah.
Then you have like wherever I put a needle, you gotta also I guess kind of understand the concept that's gonna have an effect somewhere else on the body, and understanding that pathway that it takes. And I was talking to you about this earlier this week about how points change, right?
Yes.
Based off how we grow,
Yes.
our daily cycle, our
Yeah.
monthly cycles, our
Yeah.
yearly cycles. So you will notice that over a certain period of time, certain points that you probably use will have a different effect on someone on a certain time of day. You can even probably treat the whole body with one or two points if you can find those points in the body.
Yeah.
But finding it, that like and understanding it, that's where all that study
Yeah.
comes in.
Yeah.
Acupuncture works in so many different
So
ways.
many different ways.
Yeah.
Yeah, for sure. And I think a lot of people, especially, just the common patient, the common people that just come in and are regular patients, and they don't know much about the language of Chinese medicine and
Yeah.
stuff. And so
The
it's hard
different language,
to kind of understand that language of the Chinese medicine. But, biomedically, there's been theories through research that they've been able to proven on the mechanisms of acupuncture. And I just want to go through a couple of them.
Oh, great.
So, like, the first one is a neurotransmitter theory. And acupuncture affects higher brain areas, like what you just said. It lights up the brain, stimulating the secretion of beta endorphins and enkephalins in the brain and the spinal cord. The release of neurotransmitters influence the immune system and the antinociceptive system. And so that helps with the neurotransmitters because of releasing those endorphins, the enkephalins. Those are like your body's natural opioids and painkillers within your body. That's why acupuncture is so effective with the pain and stuff.
That's what makes it so beneficial too.
Yep.
There's no outside chemicals being introduced to the body. It's just your own body.
Yeah.
Like healing itself effectively.
Yeah. And then another theory that they've proven is the blood chemistry theory. So it changes your physiological state within the body, the blood and the chemistry. So acupuncture affects the blood concentrations of triglycerides, cholesterol, phospholipids, suggesting acupuncture can both raise and diminish peripheral blood components, thereby regulating the body towards homeostasis. So it changes the blood chemistry to allow the body to be balanced. And that's why acupuncture can help with other things, not just pain, because it'll change the blood area, help your body.
It did ring a bell. Like it talked about homeostasis, which is essentially balance, right?
Yeah.
And that's something we try to effectively go for when someone comes in for a treatment. Is we try to find a state of balance in them too.
Yeah.
It's another effective way that acupuncture works too.
Yeah. And then the autonomic nervous system theory, acupuncture stimulates the release of norepinephrine, acetylcholine, and several types of opioids, like I mentioned before, those natural opioids, affecting changes in their turnover rate, normalizing the autonomic nervous system and reducing pain. So it affects that nervous system, your whole nervous system. Your peripheral nervous system, your central nervous system, it affects that to help balance that. Another one is a vascular interstitial theory. Acupuncture affects the electrical system of the body by creating or enhancing closed circuit transport in the tissues. This facilitates healing by allowing the transfer of material and electrical energy between normal and injured tissues. So it's like in the we talk about qi in the body,
electricity,
and that's like
bioelectrical.
the bioelectrical system within your body. I think it's very fascinating that the acupuncture will affect that and allow your body to heal your tissues.
Conducted by the collagen that we have inside of the body, right?
And then the gate control theory, acupuncture activates non-nociceptive receptors that inhibit the transmission of nociceptive signals in the dorsal horn of the lumbar and the gating out painful stimuli. It gates the pain. And so that helps with...
So you won't feel the pain, right? Like you'll feel something else.
Yeah, you feel something else and that gates those pains. So those are some of the current theories. I just think for our audience listening that sometimes it's easier for them to grasp how does it work scientifically, and basically, it's that blood flow, the blood circulation, and then releasing the endorphins, releasing those natural opioids and chemicals, and even things like dopamine and melatonin. Serotonin releases those things to help stimulate and promote your body's self-healing mechanisms. And it's not just that we're saying it. This is done by research,
And a lot of times you will find that when we're treating someone, you will find tension in one area. So it's not getting that circulation that it needs. And when we release that tension, they finally get that nice relaxing feeling, like, hey, this muscle is relaxing. And so all that blood flow, all that circulation gets to go in and do its job. Essentially bring someone back a little bit more back into balance.
I think it's pretty cool.
That's one of the branches of the Chinese medicine, right? Acupuncture, right? Then there's
Chinese herbs.
Oh, the herbs, yes. We were talking about that long ago.
So what's interesting, I mean, just in this is my experience, is if you go to China, you go to like Asian countries, that the herbs are actually more emphasized, and especially in China, there are more of the Chinese doctors will feel the pulse, look at the tongue, and then they'll write out a herbal prescription. And that's how a lot of the Chinese medicine is actually being done. There's a lot of herbal medicine going on. And with herbs, there are 1,000
Right.
different type of herbs, and there's formulas. And what's neat about Chinese medicine and the herbs, comparing it with like Western herbs, a lot of times, I'll see people and they say, "Oh, what herb will help with this problem?" or "What herb will help with my high blood pressure?" or help me get my energy. And a lot of people will say, I'm taking turmeric, one herbal, or I'm taking garlic, one herbal, or like milk thistle or
Yeah.
something like that
For liver,
to help with one specific thing, but it's one herbal. But in Chinese medicine, we use several herbs
Combination.
in a formula
Formula.
that will balance it out and balance, and it's very specific to that person and specific to Chinese medical diagnosis. Though there are hundreds of formulas, but a lot of times you take a formula as a base and then you can add single herbs
Later on.
to like that, to customize the herbs.
Customize it.
Or like even as a formula, you can change that formula to customize to that patient.
That's interesting.
Yeah, it's very interesting.
You mentioned earlier, I think this would be an important thing to like mention too, about how you prescribe herbs
Yeah,
based off the patterns
yeah,
that someone has,
uh-huh.
right?
Yep,
You will
yep,
feel their pulse, you said.
yep,
You will ask them questions,
uh-huh.
and based off the patterns that they're describing, like I have pain here, or my digestion, there's something going
Yeah.
on with that.
Mhm.
Based off of those patterns, that's how you prescribe the
That's
herbs.
how you prescribe the herbs.
And you will also look at their tongue as well, right?
Yes.
And you're right. So
Yeah.
the tongue will tell you a lot as well. What's going on in the state of the stomach?
Yeah, yep. Stay of the stomach, and also, like the color of the tongue,
Color of
the
the tongue.
coating of the tongue.
Coating.
It helps
Cracks.
us to, in Chinese medicine, we talk about excess and deficiency. And so those type of things will help us look at, do I need to clear heat out of the body? You can add clearing heat herbs. Do I need to boost someone's energy up? Then you can add tonifying herbs to supplement their qi, nourish their blood, things like that. For example, so if somebody came in to me and they wanted Chinese herbals
Mhm.
for their migraine, say their headaches, and they have migraine headache, and this person has, when I'm asking the questions, I feel the pulse, look at their tongue, say they're having maybe some heart palpitations or maybe some dizziness. They're having hard time sleeping, insomnia, maybe their bowel movements isn't as good, their energy is low. So we would, in a general sense, we'll say that's a deficient. They're having deficiency. We say qi blood deficiency, specifically like a spleen qi deficiency, heart blood. So spleen and heart kind of disharmony there. And so I would prescribe them a herbal formula, maybe something that nourishes the spleen. We say maybe like in Chinese herbal formula, gui pi tang.
Right.
I would prescribe somebody that will help with their spleen channel, their heart channel, to help nourish the blood, boost the qi, tonify the qi, and that will help with their headache. But if someone else came in and they also have a headache, I don't give them gui pi tang, because I feel their pulses.
Right.
I look at their tongue. They'll have a different pattern. Maybe their headache is worse when the weather changes. Their tongue is swollen, maybe not so much pale, but like a greasy type coating. and their pulses are more we call slippery. So it's like the slippery pulse is like almost like pearls rolling through. You feel it. It's not like bounding or anything. And as I ask them questions, their head will feel heavy. Sometimes it'll feel like a band wrapped around their head. Then that's a whole different formula. That's a different, even though they have a headache,
Different pattern.
it's not a different pattern. And so I would use herbs that will help just transform the dampness. They will have dampness inside their body, and transforming the dampness, nourish the spleen channel, help help with the pain. And so, one formula is called Baiju Bansha Tema Tang. That will help with that. But with herbs, like we were saying, we were talking about this, it's the Chinese medical diagnosis, the patterns that are most important, because a pattern is what will help differentiate what herbal is important. And then we use a formula that is balanced, because sometimes I think a lot of times we just think, I want what single herb can I use for this problem, but in Chinese medicine it's not like that. It's a formula that is more balanced. And the herbals, where it's also interesting, I think, is there are even here in the U.S. and in China too. So a lot of times they'll go through school and you'll learn everything, all the different aspects of Chinese medicine, including acupuncture and stuff. But then they'll focus on one thing. So they'll focus on, like a lot of Chinese doctors say, "Oh, focus on herbs," and so that's all they do. And there are actually more and more Chinese doctors here in the U.S. Even though maybe depending on states, it's a licensed acupuncturist. They only do herbs. They'll only just do herbal therapy, and they'll see people and they'll prescribe herbs, and then they'll change accordingly to help the person.
Herbs, very powerful.
Yeah, very powerful.
It's like medicine in the Western medicine, right? Very powerful, right?
Yeah.
Both come from plants, right?
Yeah.
From what I understand, herbs, I'm still a student of herbology. I'm learning as much as I can.
Yeah, no worries.
Aren't there like certain type of herbs that are just about in every formula, like cinnamon, right?
Yeah,
or radish.
cinnamon, the radish.
Are they in every formula?
Not in every formula. It all kind of depends on the use of that formula, what's going on. So, and it also depends on the nature of the herb. So herbs, you have the nature of them. You have like different flavors. So you have like sweet flavors, you have neutral flavors, you have pungent. Sour, like that. But then you also have the energetic of it, of like if it's hot, if it's cold, if it's warming, if it's a neutral temperature, And so when you're looking at the herbs, it's according to the differentiation of the patient. So if a patient came in, they have a lot of heat signs and stuff, you'll use cooling herbs to help balance that patient out and stuff. And so you'll use those herbals that will have a different taste that will balance them out. And sometimes to keep the formula even more just synergistic with the patient and within the body, and also balanced in the formula, you'll have even hot and cold herbs in the same formula to help it balance, because sometimes you can have an herb that's maybe a little bit too hot in that formula, but then you use an herbal that's maybe cool to help balance it out.
So now it's more warm formula?
Yeah.
Interesting.
So like, for example, a lot of formulas not all formulas, but a lot of formulas will have a ganzao. Ganzao is like the licorice in English.
Yeah, I've heard of
You know,
licorice. Yeah.
so
Inside of
ganzao
formulas.
ganzao helps harmonize, and it will help harmonize the rest of the herbs so that they will all work together. You
Oh.
know, and so which is very interesting. You know, so a lot of formulas they'll use, you know, several herbs, and then some people will add in ganzao to help so all the other herbs will work all together.
Gangsao is radish, right?
Ganzao is
Licorice.
licorice.
Thank you. Thank you. Yeah.
Licorice.
Trying to
Yeah.
like
Yeah.
commit it to memory.
Yeah, yeah. So, but sometimes they'll be that way. But the herbs, you know, they have so many uses as well. And, you know, with the herbs, a lot of they'll use herbals for more like internal medicine. And so things like um, high blood pressure, diabetes, kidney disease, cancer. One of the things that's interesting with cancer is you know, here in the U.S. we're pretty cautious, and so we'll use Chinese medicine to help like support and stuff, and a lot of like oncologists and cancer, they don't like to use the herbs while doing chemotherapy and things like that because of drug herb interaction.
Uh-huh.
But one of the things that's interesting, I think, is like in China, they'll use it all together. So because they feel that there is effectiveness, more effectiveness, and so in some cancers, they're treating better than what we can treat here because they'll use herbals, even IV, and
Herbal
they'll
IVs
use chemotherapy all at the same
at the
time.
same time.
And you can use those things to help support and even enhance
The effects of the
the effects of
chemotherapy.
the chemotherapy,
Wow.
you know, and or enhance the effects to help your body, you know, just
Oh,
to heal and stuff.
that's
So
interesting.
yeah, it's very interesting.
Yeah,
in
yeah,
that
yeah. That'd be
sense.
very interesting.
Yeah.
I want to research this.
Yeah, yeah.
So that's two methods of
Yep.
the many ways that Chinese medicine, how we
Uh-huh.
help people with Chinese medicine.
Yeah.
That's herbs and acupuncture so far.
Yep.
The combination of those two, very powerful effect. Right?
Very powerful. Yeah.
So,
yeah.
but that's not the only ones. There's also
No.
Chuina, right?
Tuina.
Chuina.
Yeah, yeah. Have you had
Tuina.
experience with Tuina
I
before?
definitely learned Chuina before.
Uh-huh.
I don't implement it in my practices.
Uh-huh.
A lot of time when I'm doing like a diagnosis and I'm looking for certain areas in people's bodies, a lot of people tell me, "Oh, that feels good," you know.
Yeah, yeah,
'cause,
yeah.
like I'm palpating the
You're
channel,
palpating.
moving circulation, you know.
Yeah, yeah.
So there's benefit into moving the circulation in channels, which is kind of what Chuina is about.
Yeah,
Right?
yeah. It's moving the it's so Tuina is like the Chinese medical massage.
Mhm.
And it's according to Chinese medicine diagnosis, seeing what channels affected, and you use different manipulations for the
Different ways of
Tuina.
using your hand.
Yeah, so different ways of moving your hand.
Mm.
And you when you find the Chinese medical diagnosis, like what channels affected, especially with pain, you can see what channels affected, and you can use the manipulation. You know, there's like a rolling, there's a kneading, there's nipping,
Mhm.
that way along the channel to improve the blood flow, the blood circulation, and to help heal the body.
All
And
the
a lot
effects, yeah.
yeah,
of
all the
massage.
effects of the massage, as well as pushing. You know, you push the acupuncture points. You put pressure on those points to help activate the points, activate the channel. What's interesting with Tuina,
Yeah.
though, you know, it's just not like your regular massage, like you go to get a
I was gonna say that you're
massage.
using acupressure as well.
You're using acupressure, and you're treating specific disease and Chinese medical patterns as well, and using manipulations. But the other part of the manipulation is you know, you can use in part of Tuina, though we can't do it here because of licensing laws and stuff, but in in like Asia, they'll do spinal manipulations and like cracking and things like that, joint manipulation, and that's
manipulation.
part of Tuina.
Twina.
So a lot of people say that the chiropractic medicine, because of the manipulation, originally part of it came from Tuina, because you'll see Chinese doctors learn that, and then when I was in school, my teachers taught us different manipulations, but we're not allowed to practice it
Because of licensing
because
issues.
of that. Yeah, scope of practice.
Scope of practice.
But we did get an understanding of it, of like some of the manipulations and
So the origins and roots of chiropractic care originated with Chinese medicine, right?
yeah
In Chuina.
in Tuina.
Mhm.
And the other part, in this could fall under Tuina, is we call bone setting. So in Chinese medicine, we say 正骨, and they say 正骨 Tuina, which is the bone setting. And so that's like, and this is a very highly specialized aspect of
Definitely.
Chinese medicine. Like if you broke your bone, like you broke your arm, you go see these guys, and they'll do like Tuina manipulation and then set the bone.
So if
And
it's
allow
like
you
it
to heal.
fractured and like the bone is like one place is up and one place is down, they
Yeah.
will manipulate the bone to put
Uh-huh.
it back into
To
its
put it
setting
back
position.
into place
Ooh.
and set the bone
Yeah.
so they can heal. And then sometimes people, they'll use, herbals and stuff like that
Mm.
to help also heal. So then you're healing naturally. So, it's a specialty, the bone setting
That's
and
interesting.
stuff. Yeah, it's very
They
interesting.
do that. Is that like a scope of practice in China? They
Yeah,
can do
yeah.
that as well?
Yeah, they do that too.
Oh,
So,
fascinating.
yeah, it's very fascinating. And so, but the Tuina is a lot of times, like in my practice, I'll use the acupuncture and then I'll give the herbals. But then after the acupuncture, sometimes I'll use the Tuina, some of the Tuina manipulations just to enhance the treatment,
Mhm.
help them to feel better as well. Whether whatever part I'm using, whatever manipulation and stuff.
So, random question: is cupping a part of Chuina, or is that just something different?
So cupping is part of the acupuncture realm scope. Yeah. So with acupuncture, we use the cupping, use the moxibustion,
Mhm.
and so even in Chinese, when you say acupuncture in Chinese, 针灸, 针 means needle,
Mm.
灸
Herb,
is the moxa.
moxa, you
Yeah.
and moxa.
Yeah.
Yeah.
So you use it together,
Hmm.
So very interesting.
I haven't heard that one since school time. That's a lot of things that people don't know is that the way it's spelled, it's needle and moxa, right?
Yeah, yeah.
But we just say acupuncture.
Yeah,
Right.
because people like the needle. So
That's
the
three ways,
Yeah.
right? And then my favorite topic is martial arts wise.
Oh yeah,
Right,
definitely.
right? Physical movement, physical
Yeah.
exercise.
Yeah.
Another component of the medicine that we use, right? So it's not just acupuncture, it's acupuncture, herbs, Tuina. Am I saying it right?
Tuina.
Tuina, and physical movement, right?
Yeah.
Now in Master Lou's for physical movement,
Yeah.
I love to introduce this to people, is Tai Chi. We like to teach people Tai Chi
Yeah.
for health, right?
Yeah.
It's also like a meditative practice as well.
Yeah.
Keeps you growing, keeps you healthy. It's
Yeah.
good for your vitality.
For sure.
Mm-hmm.
Tai Chi is, it's practiced all around the world. Helps with your balance, your coordination, strengthening, physical fitness. There's several
Circulation.
studies that have shown that it helps with your heart, your cardiovascular system. There are several research studies among seniors that it helps reduce falls by over 50%.
Wow.
Yeah, so it helps with that balance. Improves the immune system as well. There have been studies shown that it helped senior citizens to not to prevent from having shingles or improve their immune system.
Keeps that circulation
Yeah,
going,
it keeps
right?
the circulation, and also helps with your mind because you have to think about it. So help with like dementia, Alzheimer's, help kind of prevent those type of things. So because when you're practicing Tai Chi, you have to think, you have to remember, and that's part of Tai Chi, Qi Gong, all of those types of exercises just help your body overall and improve that circulation, help your body heal itself.
Now the Tai Chi is different.
Yeah.
Because this Tai Chi that your form, your father taught you, right?
Yeah.
And he learned it from his
teacher,
master,
yeah.
Grandmaster Yin was his name,
Grandmaster
right?
Yin. Yeah,
and this
Yin
comes
Chen
all the
Hao.
way from China, right?
Yeah.
It's Yin style, Yang style Tai Chi.
It's an old Yang style
Old
Tai
Yang
Chi.
style Tai Chi.
Yeah.
Yeah.
108 movements, and it comes through the Yang Xiaohou lineage, but it's a different older brother. So, but this form is very unique. I've seen many different Tai Chis before and everything, and this particular set Tai Chi form has a lot of lower movements, a lot of more like even martial movements, because Tai Chi you can use for self-defense as well. And so you can use to help defend and protect yourself. But and I think because of that, it is an older form. It's an older form than most of the forms that come from Yang Xiaohou's younger brother, Yan Chengfu. And so it's different.
Did your father ever tell you stories about how his Master Yin, learned it?
Um, He did a little bit, but I've read things about, and he said that he went to Beijing, and this is in the early 1900s.
Early 1900s.
Yeah, like probably around 1930, maybe 20, somewhere around that at that time. Went to Beijing, and there was a master there who was a student of Wu Zhenquan. And Wu Zhenquan and Yang Xiaohou were contemporaries. They practiced with each other.
Okay.
And according to my grandmaster's, he wrote a history. And according to that, he said this form is the Yang style, but it was passed to Wu Zhenquan. And Wu Zhenquan is also attributed to creating as part of the Wu style Tai Chi. But this particular form is a Yang form that Wu Zhenquan learned, and then he actually taught it. And so it's a different form that I've ever seen, anywhere else. And I think it helps a lot. It helps a lot of people. The thing with Tai Chi, after where we tell our patients, you guys got to do Tai Chi. It helps prevent,
afterwards. Yeah.
Prevent from having illness.
For your longevity.
Yeah, and we have students that they've done the acupuncture, and then they'll do the Tai Chi, and the Tai Chi's helped with their back pain, with their joint pains, with their energy.
Yeah, so you got to do your part too.
Yeah.
Right? Like acupuncture, we can help relieve your pain. Yeah, but if there's some sort of structural imbalance that you have in your life, in your body, that you haven't addressed with physical exercise, you can think it's gonna come back.
Yeah.
As long as you keep using those shearing forces or whatever's causing your pain, it's gonna come back. But that's the benefit of the Tai Chi. Like that's the physical exercise.
Yeah.
A lot of people have a hard time getting started with physical exercise.
Oh yeah, definitely.
They don't know what to do. Should I work on this? Should I work on that? You have these wonderful videos online. I tell my patients to start with those videos. We already telling you what to move, how to move it. So making it a lot easier for people to get started with physical exercise.
Yeah, for listeners, they can look at our YouTube channel, and then also on the Alpine Harbor YouTube channel. That I have all the Tai Chi on that channel too, and they can go there and subscribe and. You can start learning.
There's an interesting thing. Whenever I get a new guest into Master Lou's, I like to show them the gym.
Oh,
where,
yeah.
where we practice Tai Chi. I like to show them the newspaper articles. There's these newspaper articles that came out in the early 90s.
Yeah, yeah,
Yeah,
yeah.
like your father's there and he's teaching the Salt Lake community Tai Chi there. And
Yeah.
there's a newspaper article about Grandmaster Yin as well,
Yeah,
I
yeah.
believe
That
too.
was back in the 70s.
Right. I don't know where you can find them, but I try to show them to everybody the first time they come in to visit.
Yeah,
Right.
that's great.
So there's a difference though between Tai Chi and then Kung Fu, right?
Yeah, Kung Fu.
So Tai Chi is just one component that we teach in Master Lu's Health
Yeah.
Center. There's the Kung Fu side too, right?
Yeah, the Kung Fu side. So in Chinese martial arts, you have the internal martial arts, you have the external martial arts.
Right.
And so Kung Fu is the external. So that's all the fast stuff that you see. And the difference, the Tai Chi and other internal martial arts will help build your energy inside and then it's expressed out. Whereas Kung Fu, you help build your muscles and bones outside first, and then it develops your internal energy. But the Kung Fu is fast. We practice the northern style Shaolin Kung Fu, which has more of the kicks, the jumping. We also have a lot of the weapons that we practice, like the staff, the spear, saber, sword. And
I saw you the other day practicing with the fan.
yeah.
I was kind of being a fanboy watching you practice
with the fan.
Yeah.
Yeah.
It's an interesting form.
Yeah, so we have a lot of weapons and the Kung Fu it's great, because it not only physical exercise, keep you fit and stuff, but also helps with like your confidence, your self-esteem, helps with your emotions and stuff, and so it helps transform your life.
Right, the
discipline.
combination.
Yeah, helps with discipline. So
Discipline. The external and the internal style.
Yep.
It's like a growth of body, mind, spiritually. They say you also you grow as well.
Yeah. You want to explain some of the martial arts you practice?
So I would just like to say hi to my current Shifu, Susan Fries from Longevity Healing Arts. I've been practicing with her for over a decade now. And I practice a form called Bagwazang, right? One of the three complete systems along with Tai Chi Quan. Do I say it right? Tai Chi
Chuan.
Tai Chi Chuan. Yeah. So that's the style that I practice. It has a lot of fundamental principles, and it's a different type of martial arts, where it's more technique based. As in, before I strike, are my legs in the right position? Am I having this wave in my spine that's supposed to be expressed right before I hit the strike? So it's a different type of martial art, but still the same thing in terms of you grow physically.
Yeah.
It keeps you healthy in your longevity, right? It emphasizes on flexibility as well. You grow mentally, you grow spiritually. You have a deep belief in yourself that, hey, like this was hard, but I did it.
Yeah.
And then over a period of time, you keep doing it and you grow this belief in yourself, right?
Yeah.
And this confidence that builds over a period of time. And I can't tell you, I don't know how, but like academically wise, it kind of helps you out going to school, like for graduate school, undergraduate school. How I got by was, believe it or not, was acupuncture and also martial arts.
Oh.
It kind of like before I would go to my class, I would practice and it would kind of settle me. So by the time I was in class, I was wired. I was paying attention.
You're like, more focused.
Yeah. Writing things down. And I looked to my left, to my right, and my fellow classmates, they're like, what's going on?
Yeah.
That which was often me. That was me often when I was growing up in school. But then I added martial arts to it. And when I went to school, like you said, I was more focused. I was more disciplined. I was just grasping things a lot easier as compared to before when I didn't practice.
Yeah, that's great. Yeah. That's awesome. Good experiences. So that's number 4. So number 5 is the nutrition, food therapy,
diet.
It's
important.
That's very important. The old Chinese doctors, there's one, his name was Sun Simiao, and he says in his books, most diseases can be cured and helped with by lifestyle changes, dietary changes. And then if not, then you turn to herbs, acupuncture, things like that,
Hmm.
and medicinals, things like that. But the food is very
Very
important.
important.
The things
As we
that
all
we
know.
eat now
Yeah.
and how we eat and stuff. Um, One of the things that I just wanted to point out that's very interesting, and I think it's pretty unique with Chinese medicine, is the notion of raw, like eating raw all the time. Not saying that eating raw is bad or anything like that. I'm not, saying no, you can't do that. It's not good for you, because again, it's a balance. But if you eat too much,
Too cold.
too cold in your body, then that causes in Chinese medicine the spleen channel to have disharmony.
Mm.
And if that's having disharmony, then you'll have, loose stools, stomach aches, low energy, things like that. And and so a lot of times in Chinese culture itself, everything's always cooked, everything's warm, even like water. You go to Taiwan, China, you drink water, they'll give you hot water,
They do?
to drink.
Oh,
Yeah.
I've never been.
Yeah.
That's interesting.
So that's what they do
Because
a lot of times.
not cold water because it's too much cold for the belly,
Yeah. Too much cold stagnates and
and that'll
constricts.
have an effect on the channel.
Yep. And that has an effect on the channels.
And you can see that with other foods too,
Yeah.
like what we call damp foods, right?
Yeah.
So like a lot of fried foods,
Fried
right?
foods.
Fried food. What else is a damp food? Sugary foods, sweet
Sugar.
foods, right?
Yeah. Sugar foods. Foods that are more greasy.
Greasy.
That will cause a lot of
A
dampness.
lot of dampness
in the body,
Mhm.
and that will cause health problems over time. And so the unique thing with food therapy is that each food also has a energetic to it. So whether it's cold, warm, neutral, so you can actually use food, like if you have a heat condition, you can use a cooling food to help kind of balance your body. Or if you're too cold, then use a warming food. A lot of the meats are warming, so like beef, chicken, things like that. They're like a warming food. And then some of the vegetables some of them are cooling, some of them are warm. So but the important thing with food is eating the rainbow, so all different colors, and trying to be consistent with all different colors of food that will help prevent illness, but also help if you're going through illness right now to help manage or cure your illness.
That's an interesting thing. I never heard about that before. The eating the rainbow, like
Yeah.
a rainbow type of foods.
Yeah.
For instance, I had a patient a few weeks ago who was developing who has developed a blood deficiency,
Oh.
right? So I advised, like, gave her education on eating foods that build blood,
Oh yeah.
right? So you think more red foods? Am I
Yeah.
wrong?
Yeah.
Something like beets
Yeah.
will
Yeah.
help build blood,
Mm-hmm.
and so what would like yellow foods, if there is such a
The
thing?
yellow, yeah, the color
Uh-huh.
of yellow is related like to the spleen, so help build
Spleen
your
channel.
energy
Build
and stuff like
energy.
that.
Interesting.
So that color, if you're looking at like 5 element type theory and stuff. So yeah, yellows, reds, purples, greens, very green foods will also help nourish the blood because that green is related to the liver channel. And so you can do that.
Yeah.
Um,
I'm gonna pick your brain.
Uh,
What does purple do?
purple is more like, I think it's more like neutral type. So,
Neutral.
yeah. And then like the black colors and stuff is also, but black is related, that color is related to like the kidneys and stuff. But yeah, I think all the colors is important.
Definitely foods. What you put in, like inside of you, is definitely important. It's gonna manifest. right?
Yeah.
And it'll manifest in your channels, like someone with a lot of dampness. Whenever I palpate the spleen channel, there's always like a lot of pain there, especially around spleen 9 area.
Yeah.
You hear a lot of ow, that hurts,
Yeah.
like around the inner part of their knee.
Yeah.
You know,
There's,
my first mentor, he would say that you can get by pretty far in life if you eat right,
yeah.
but you gotta eat right.
Yeah, you
know?
got to do it.
Mhm.
And I think it takes a lot of
A
discipline.
lot of discipline.
You know, especially in our modern time, you know.
Yeah.
People are busy, people are rushed, and then we also have a multitude of ways of people are growing their food here and processed, all that type of stuff. You have to, read labels, things like that, so you can, be as healthy as you can be. I think it's going to be hard to be 100%, but you can always have a higher percentage and just improve little by little, I think. And what's interesting is most of the patients that I see when I ask them, how's your diet? What type of foods you eat? They always first say the meats. Oh, I eat a lot of chicken. Oh, I eat some beef, some chicken, but they never mention any vegetables. And I say, oh, you need to increase your vegetables, more vegetables.
But there's a certain way to eat them, right?
Yeah,
I've often heard you say to
cook the vegetables and stuff. Yeah.
over cold,
Yeah.
eating them raw.
Yeah. Not saying that eating raw is bad, but if you do it all the time, then yeah, that's too much. So you have to cook the vegetables. It enhances the warmth. It helps with the body and stuff. And then if you do eat, like a salad or some raw vegetables, that's fine. But you also have to look at your disease state.
Right.
If you're like deficient and even if you feel cold hands, cold feet all the time, then you want to eat more warming, cooking your vegetables, bone broth soups, things like that. But yeah. So, but I think that's great. I think it's a good overview. And wrapping it up, I think a lot of people, as Chinese medical practitioners, Asian medical practitioners, that we just don't do only acupuncture. Though that's probably one of the largest things. But I think a misconception is that we're kind of identified by that because, we're here in Utah, we're say licensed acupuncturist. And so people identify, oh, that's where acupuncture. But as Asian medicine practitioners, that we do not only acupuncture, but the Chinese herbals, the exercise, the tuina, and the nutrition. And that is part of it. That's the whole thing. And that when we go to school, that's what we learn. And we learn all those aspects. And that is what will help. That's the medicine. That's what helps people feel better and help people overcome their health ailments.
And you can find almost all these components at Master Lou's Health Center, where we educate people on their diet. We help with physical movement. We have acupuncture, but cupping, right? You would apply tuina if you have to.
Mm-hmm.
I keep saying that wrong word.
No, you're fine. You're fine.
Yeah.
Yep. And so, all of those areas. So, people have different health conditions and stuff. They can call us at Master Lou's Health Center or go on to our website at louhealthcenter.com and they can schedule an appointment, and we're happy to help.
Thank you, everyone.
Yep, thank you. Thank you for joining us. We hope you enjoyed today's episode. Please like and subscribe to the podcast and YouTube channel. We'll see you next time.